Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
You know, I'll tell you, when I go out on the street of Annapolis and I run into somebody and I tell them that I'm coming to do a podcast with somebody and they say, "Oh my God, that's a great company." And lo and behold, here we are with Silverstay. I guess you guys are based out in Odenton, aren't you?
So a
lot of virtual.
I guess our corporate headquarters. So
okay.
You're in them right now.
Okay. It's a wonderful conference table.
Yeah, indeed. This is the finest that Pottery Barn has to offer. My wife did an excellent job selecting it as we sit here in my dining room, I guess. Yeah.
Well, I think we are talking with Patrick Mish, who is the CEO of Silverstay, and the website is silverstay.com. And a disclaimer on that one is that the woman that said it was a great company to work for is the mother of somebody that does work for you, but that's still pretty good kudos when you get mom behind you.
It's a good endorsement. I'll take it for sure.
Well, you know, I tell you, I know that we wanted to talk because as some people, not me, get older, I know that it gets a little bit more difficult just to navigate. I mean, physically navigate, move around, but the bureaucracy, the hoops that you need to jump through as you get old. I mean, I know I've got a friend of mine that has created a third career at this point now, consulting with seniors on how to do the whole Medicare thing.
Yep.
And it's not as simple as like, "Hey, I'm 65. Where do I sign? And where's my check?"
That is a whole topic that we could spend an entire podcast on.
But the other thing is that as we get older, and I mean, our generation, we'll say the baby boomers into what's after baby boomers, Gen X maybe? Or whatever's next.
Yeah, but
I get confused on them. But, you know, as we all age, I mean, some of us are going to be, healthy as horses and, live to 100 and, go out in a blaze of glory or something like that. Others are going to need continuing care or assisted living. And that's really kind of where Silverstay comes into play, right?
Yeah, that's exactly right. So Silverstay is a company that is a transition support business. So we help folks, the kind of folks you're talking about, people who tend to be medically complex, who maybe are failing at home.
That's a great euphemism. I like that. Well, medically complex. I'm writing that down.
Write that down because we can get into what a medically complex person is. It's pretty interesting. Times have changed quite a bit. And so we help these folks who are failing at home. They may not have a home, get into an environment that can manage their care in a really robust fashion and help them in as much as it's possible really thrive in the long run.
Well, you get the right place, and I've had my own little experiences with elderly. My parents have both passed on, and my girlfriend, relatives, and stuff like that. And it is very critical. And you said to get into a place where you can thrive, because if you're in the wrong place, you're in the wrong place.
Yeah,
I mean, it's bad.
It can be really tough. So, just to kind of level set. So this is the general consumer gets really confused when it comes to talking about long-term care settings. So, there's assisted living, there's nursing homes, there's long-term care, there's in-home care, there's all of these different options that are out there. And a lot of times, the general consumer is just that they conflate all of these things and they just haven't ever learned. And so let's start with some definitions of what the possible settings are out there. And then we can kind of get into what makes the right setting. So assisted living. So assisted living is a home-like environment. So we're sitting here in my home right here in Odenton. Someone might take this home and convert it into a licensed assisted living community. In Maryland, the Office of Healthcare Quality oversees the licensure for assisted living communities. And so there's all these kind of different things you have to go through to do that. But you take this home and you turn it into an assisted living community. You have people come in, they pay you, and you deliver care. And that care is for, helping you get dressed, helping you get around, helping you with some activities, bathing, toileting, making all your meals for you, ensuring you get to your doctor's appointments and take your medications properly, those kind of things. That's one version of assisted living. And there's another version that's a little bit more fancy, more hotel-like, where, you've got your own private room and your own private bathroom. It tends to be a little bit more of an expensive setting, but similar kind of things are happening there. You're getting these activities in daily living. Then you've got nursing homes. So nursing homes, and the term nursing home and long-term care, you'll hear interchangeably used, and we'll probably do that during the course of this discussion. Nursing home tends to be a little bit more of an institutionalized setting. So here in Anne Arundel County, we have several skilled nursing operators. So Autumn Lake, for example, is one. Crofton Rehab right down the street here is now an Autumn Lake facility. So those kind of facilities run two different things. They do PT and OT for patients who kind of come in, stay for 3 weeks, get physical therapy, get occupational therapy. Maybe they're coming from the hospital. They've had some kind of event. They get the rehab that they need, and then they go on back home or wherever it is.
Right. Okay.
Then on the other side of that, you've got those operators are running long-term care beds. So this is for people who have pretty high clinical needs, very sophisticated medical stuff going on, and they can't live at home. And they may not be able to go into an assisted living community, or they may not have the money. They may be on Medicaid. And so that's a place where these folks can live permanently and get the care that they need. So that's the distinction. Then you've got, in-home caregiving agencies and home health and that kind of stuff. A little bit of a separate discussion. But to your earlier point, ending up in the right environment, right? You got to end up in the right environment. And, if you're at home, and this is a huge trend right now, is families are spread out all over the place. So mom and dad are at home. Kids are living, on average, the stats on this are like 200 miles away. We had a little bit of a discussion of this earlier. Like, families are spread out. So when somebody starts to fail at home, mom or dad starts to have issues with mobility, maybe has some early onset dementia and is having some behaviors, and then the spouse is trying to deliver care, but they may have their own health issues, and then family isn't nearby to be able to really jump in there and help out. So what do you do? So we can get into that whole topic.
Well, that's a huge issue. And,
huge.
If you've got we'll say an elderly married couple, and, dad falls down the steps, and, mom is unable to do much more. Maybe they're going to be able to call 911. Maybe not.
So this is like a classic example. So dad falls down the steps. Mom calls 911. Dad goes out to the hospital. Dad has maybe broke a hip. Okay. So he's got to get that dealt with at the hospital. Then he's going to go to a skilled nursing facility for a couple of weeks and get some physical therapy and occupational therapy. And the hope is that he's going to be able to go back home. But let's just say that that whole event has resulted in dad being unable to use steps. And dad lives, it's a split foyer house, right? Sure. Walk in the front door, you got to go up or down. So now what do you do? Now you're stuck. So you can do some equipment modifications at home, but maybe that's not the solution that's going to work. Maybe mom isn't really equipped to be able to continue delivered care for dad because dad's got other stuff going on that's really complicated. And so then it becomes, okay, what are we going to do here? And then you might start looking at assisted living. Okay. And then this gets into the assisted living is a private pay environment. This is not covered by Medicare. There's no health insurance that picks this up. There's something called long-term care insurance, but very few people have that.
Mm-hmm.
And so, all right, how am I going to pay for this? And that opens up the whole nother discussion around the finances of this, right? I can't go necessarily into long-term care or nursing home unless I'm going to pay for that, or I have to be on Medicaid. And to be on Medicaid, I've got to meet income eligibility requirements, right? And this couple may not do that. So it opens up this whole can of worms, and it's extremely confusing to the consumer.
You've taken the last 5 minutes and just confused the hell out of me. So I can't, and I like to think that I am a little bit with it still. And I can't imagine that somebody is going through with this, but I mean, Silver State does come in at this point to somewhat, and I know that you're a data driven company.
Yeah.
And I mean, you're looking at what can work for who, why, and everything else. And, rumor has it that you're like a rocket scientist or something like that by trade, but somehow. So how does the process work? Silver State, I mean, you are locating communities or facilities for somebody?
Yeah. So let's talk about Silver State. So sort of how the rubber meets the road in our company and then what our process looks like. So we have a really experienced team of licensed social workers, and that team is working with medically complex individuals and their families and their guardians and their proxies to help identify what is the right solution given your circumstances, right? So something has failed at home. Maybe you didn't have a home. Maybe you're in the hospital now and you got to find somewhere to go. Okay. That's going to be able to manage your care appropriately. So our team has a lot of expertise in that. The other piece is we've got a lot of data. So we're the only organization out there that's collecting data on assisted living communities specifically. So just a tangent on that for a moment. So if you went online right now and Googled around for assisted living communities, you'd find many assisted living communities, some of which would be right here in Anne Arundel County. They would be mostly the larger assisted living communities like the Sunrises and Bright Views that probably have driven past, right? Even coming over here.
Sure.
Those communities are wonderful, but they're really expensive. And that Google search wouldn't make any indication to you around whether or not they can manage the care needs that this individual has, that mom or dad has. So our company is collecting really, really nuanced data. For example, let's just say that dad is a larger person and he's broken his hip. And in order for dad to get in and out of bed, it's going to require 2 people to transfer him in and out of his bed. So from the bed to like a wheelchair. There's no way right now to determine if an assisted living community has the capabilities to do what's called a 2-person assist right now. No data out there at all. We have that data. So we can really quickly take a complex patient with this really skilled team, identify the right set of communities for that person, and then make the process of the transition super easy. So, transitioning from your home, or maybe you've never even had a home, or maybe you're living in an apartment, or maybe a motel room, to an assisted living community is like a real estate transaction layered with a massive amount of medical complexity. So it's hard to do. So you've got to sign legal documents. You've got to transfer money around, but you've also got to make sure the right medications are at the assisted living community in the right doses, and everybody knows how to deliver those medications and everything. And, durable medical equipment. A lot of people need wheelchairs, walkers. Some people need hospital beds. All this stuff has to be lined up and delivered in a way that things are going to happen correctly when you show up there, right?
It's funny. You talked about the 2-person assistant. I've got a friend of mine whose mother was in a nursing home and, pretty much incapacitated, and, she got thrown out because they had a single person could turn around and help her get out of bed and into the chair and on the chair and onto the toilet and so on and so forth. But as her capacities waned a little bit and she wasn't able to, do a little bit of her own assistance.
Yeah.
It was requiring a 2-person assistant. They just didn't have the staff for that. And they said, well, she can't stay here anymore, and threw it into a whole thing. So, that's absolutely critical. Those are some of the things that nobody would think about going in.
No one thinks about this stuff, and it's a real rubber meeting the road kind of problem. And if you have the data, then you can very quickly, for our team, the hospitals pick up the phone, they call us. So this gets to the process, right? So we probably see anywhere between 100 and 150 referrals in a given month. And I would say probably about 2/3 of those come from hospital systems. And what will happen is a social worker or case manager in the hospital will call us or send us a referral electronically. And it's like, hey, I got this patient here who's stuck. They can't go back home. They might have been in a situation that you're talking about. They were in a long-term care facility that they require 2-person assist. They can't go back to that place. We can't find another facility that can do a 2-person assist. Can you guys help us? So we can digest all of the clinical information around this person's needs and some of the softer stuff, like, life is messy, right? Like there's complexity in family dynamics. There's complexity in background, in, criminal histories and substance abuse, and things have happened in people's life. And so we can bring all this data together, and within like 5 minutes, we can identify, 3 to 5 communities that are really, really robust with proven track records of managing folks very similar.
Where are your communities? Obviously they're not your communities. These are communities that you've done your background and your information on. But is this nationwide? Is this isolated to Maryland or the Mid-Atlantic?
So today we are heavy footprint in Maryland. So interesting thing about Maryland. Maryland has a really robust assisted living network. There's like 1,682 assisted livings. I think that is the exact number, 1,682 assisted living communities in Maryland. That represents about almost 27,000 assisted living beds. That's a very robust assisted living. Maryland is very fortunate in the way that the regs are set up in Maryland to be able to have those kind of assisted living beds is pretty exceptional. So we work primarily in Maryland. We do some work in Virginia, some work in Pennsylvania, surrounding states. And sometimes folks call us up and say, hey, I got to get to Florida, or I need to get out to California or Nevada because, this is where my family is and I want to be near them. Can you guys help me? And so we have a little bit of a different process when we're working with those types of situations. But a lot of assisted living communities here in Maryland and a lot of data around those communities.
That's fantastic. You said 27,000 assisted living beds in Maryland. As we're all getting older and the potential to be taking one of those beds, is that enough?
This is a great question. So there is a supply and demand mismatch. And here's where the mismatch is really happening. So we have baby boomers who are moving in to this age window where the medical conditions are starting to cause problems in their world. And we've got folks who have suffered major financial setbacks because of the 2008 financial crisis, then the pandemic, or maybe they never made a lot of money in their careers working physically demanding jobs. So we've got older adults without a lot of income who need assistance. They need care. They have care needs. Where are they going to go? They're living in apartments. They can't return to those apartments. They've got to go to places that are low cost. And Maryland is fortunate in that it has a pretty robust low cost assisted living market, but that's where the supply and demand mismatch is beginning to happen. There aren't quite enough of those low cost beds out there.
So we'd contact you after an event that needs that. I mean, this is not necessarily, your services with Silver Stay are not necessarily something that is planned, or can it be?
Well, in the ideal world, it would be. But folks just don't tend to think about these.
I know exactly where you're going. When my mother was in assisted living, she was in a continuing care, so she bought into it, was able to turn around, and got part of her money back when she passed on. And for 2 years, she lived in her old house and would never move in because she called it God's waiting room, and she didn't want to go, go over there with the old people. But she would go over every day for dinner and lunch because, she's paying for it. So, so she wanted to get her money's worth. But it took her 2 full years to get in. And that was just really sort of digging her heels in, saying that was not what it was for. So I totally see that you've got some resistance from people going, no, I'm not ready for this. This is not for me.
And people want to stay in their homes. And my mother is a great example of this. So my father passed away in 2015. Really, that was a big impetus for starting this company. We can get into that. But she lives alone in a split foyer house. She's doing great. Mentally, she's great. Physically, she's great. But eventually something is going to happen, and it's a split foyer house. Like, how are you going to get in and out of that house? And how are we going to make this work? So we are having those conversations. Like, okay, do we put an elevator in? Do we put a chairlift in? What's it going to look like? But that's the general theme. People don't want to leave their homes. And I get it. Like it's not a comfortable thought.
Well, there's a whole another industry, and we spoke with somebody that does this, that it's the in-home care.
Yeah.
And that can look any number of different ways, where somebody is essentially a live-in aid, to somebody that just checks in daily, or somebody that comes depending on what the needs of the person is. Hey, I'm just going to come in here every week, make sure that the pills have been taken, the food in the refrigerator, and the bills are paid.
Yeah.
And as your needs change as you age, and ideally, we all want to live in our home. I get it.
And in-home care is an excellent solution. And so if you have the financial resources, so, if you need, 24-hour care in home, you're looking at about $300 a day. And it might even be a little bit more than that now. So $300 a day, 30 days in a month, that's $9,000 a month, 12 months. So,
right. Do the math. It's more than I've got fingers.
It's a lot of dough. And, this is the problem. So there's certainly is a segment of the baby boomer population who's done a great job saving. Some of them have long-term care insurance policies. My mother is one of those people. She's got this fabulous long-term care insurance policy that will pay out hundreds and hundreds of thousands of dollars. And so she's set. Like, if she wants to stay in her home, she's got her head wrapped around that. Like, she's got the resources to be able to do that. She's one of the lucky ones. For folks who don't, who are living Social Security, paycheck to paycheck, $30 an hour to have a caregiver come in isn't going to work. It might work for a little while, but not in the long run.
Yeah, that's, again, I'll go back to my mother. When she bought into the thing, the community was sold by a real estate agent. And the pitch was like, as long as you can walk in, no matter what happens, we got you covered.
Yeah.
And then when whatever happened, we realized that it wasn't. There was no long-term care. She was considering it, but they said, oh, you don't need it. We'll take, if you need extended care. And I guess what they were saying is that, if you fall down and break your leg, we've got a rehab center.
Right. Yeah.
If you, lose, start to get dementia, we've got a dementia wing and everything else. But all that came with cost that she didn't anticipate.
Yeah.
And, in the end, she, it's like the old joke. It's like, when I die, I want to go in, sliding into home plate, penniless, broken,
Yes.
and that's pretty much where, where she was. I mean, there was very little left, and it went into that care because she, had dementia, and it was for too long. And it's really difficult when you see that. You mentioned your father was the impetus to start this.
So God works in interesting ways, and God delivered an interesting one on this one. So the headline here is my dad had brain cancer. So summer 2015, he starts having hallucinations. He's in his mid 70s at this point. He'd worked at NASA Goddard for 40 years, started working at NASA in like 1960. So, during like the heyday of the Apollo missions, like classic stuff, as a mechanical engineer, graduated from George Washington University. Fabulous career, idolized, raised 3 boys. We idolized him. He retired in 2000, and he's living out his best life. He used to build boats down at the John Gardner School Boat Building down in Annapolis.
Oh, awesome.
Yeah. And, just having a great time. And summer of 2015, he starts having these hallucinations, and he's seeing people that aren't there. And, we're all like, Dad, something's up here. He's old school. It's like,
nothing wrong here. Give me an aspirin, I'll be fine.
Exactly. He's like, he hates hospitals, doesn't want to go to the primary care physician. So it took us a while to kind of get all this stuff figured out. But that summer, very, very rapidly, he went from someone who was super high functioning to this person who, when I walked into the house, he was sitting on the couch in his underwear and an undershirt trying to eat seashells. And just taking everything apart too, like just trying to, the engineer in him was like really coming out. And it was this tumor in his brain that was messing up his executive function. It was in his like left frontal lobe and was causing all of these really, really interesting behaviors. So like he would be on the move, like healthy guy otherwise, right? Like he ran marathons. He's a runner his whole life. Guy was in great physical shape. So he would be out the front door and be like, Dad, no, like you need to so we would get him in the car. We'd drive him around for hours and that helped to kind of settle him down. But we went up to Hopkins. We had surgery done at Hopkins. They took out the tumor, but cognitive function never really returned. In fact, it got a little bit worse. And so then we were stuck with, well, what are we going to do? And so this is this massive transition, right? High functioning guy in July. Here we are, late August.
Oh gosh, so it's only a month.
I mean, it was incredibly fast. And, fortunately, again, this is rare, right? Like myself and my 2 brothers all live nearby within about 20 minutes of my parents. So we all were able to kind of rally around and dig in and try to figure this out. But it's like, what are we going to do? Like, how are we going to manage his care? Are we going to bring him home? Are we going to go to assisted living? Are we going to long-term care? There was like post-acute care was discussed, subacute rehab, acute rehab. At that time, we had no idea what any of those terms that I just rattled off meant. Totally clueless. So, the whole thing was very jarring and confusing. And we ended up finally bringing him home. We got connected up with a really great social worker at Hopkins who was really instrumental in giving us guidance. So we brought him home. He passed away peacefully on October 27th, 2015, which just so happened to be the same day that my wife gave birth to our 4th child. He died at 3:00 in the afternoon. And Grant, my 4th child, was born at 11:11 p.m. that night. Like, so you want to talk about quite a day.
Wow. So it's odd that things like that happen. Just, you don't know what the kismet in the universe is. I know my grandmother had passed away literally within about 4 minutes of my youngest being baptized.
Wow.
So if you're thinking about this whole, exchanging of souls and stuff.
Yes. This is exactly like these 2 souls like passing.
Yeah. You're just like, wow. Okay. So that's, kind of bizarre. As we look at Silver Stay though, I mean, what's bringing the aging community into assisted or continuing care today? I mean, you mentioned your father had brain cancer, and we know cancer is all over the place. I mean, COVID, knock on wood, is hopefully, not doing, what it was doing, but is it cancers? Is it just ages? Is it dementia and Alzheimer's or?
So, a lot there. So we work with medically complex people, right? So that runs the age gamut. So let's just for now talk about older adults. So what would more classically fall into this baby boomer window. Those folks, the sort of medical complexity that we see there is a lot around dementia. And then there's all of the other issues associated with having lived a hard life, right? Worked a physically demanding job. You've got sustained injuries. some folks have abused alcohol for decades, and that leads to some cognitive decline that can lead to some interesting behaviors. And then you got, people who have diabetes, overweight folks, and not necessarily those two together, but sometimes together. You've got congestive heart failure situations. People's bodies just start to break down as they get older. And some folks have really tried hard to take very good care of themselves. And dementia is going to come for you, whether you've taken really good care of yourself or not, if you're going to get dementia, right? It's going to happen eventually. Others have not just been afforded the luxury to take really good care of themselves. And some of that starts to catch up with you as you get older. So that manifests as people who have, when they have dementia, sometimes they have really, really challenging behaviors. They act in really, really bizarre ways. And it's hard to understand those behaviors. And it's really hard to deliver care to someone who maybe is verbally aggressive with you or even physically aggressive with you. And so it takes really good skills to know how to navigate your way through that very patiently. Dealing with someone who has years of substance abuse issues is a whole nother set of skills that, you've got to be able to navigate your way through pretty carefully. And then, just the medical, having the medical know-how, in an assisted living community, they have a delegating nurse who's coming in and seeing these patients and bringing that clinical expertise. And, the smaller assisted living communities, those that do a really, really good job with medically complex people, oftentimes those are started by people who are retired nurses. So they've been in the healthcare field their entire career. They're really passionate about caregiving, and they start an assisted living community. They take a house just like this, or maybe a little smaller, and convert it into a licensed assisted living community. And they care for these people, these really complex.
And that's just a 3 or 4 bed facility.
Yeah, it might be as high as 5 or 6 beds.
Right.
They might convert like this dining room, they might convert into a bedroom. Yeah.
You talk about medically complex individuals and stuff like that, but looking at Silverstay, and again, silverstay.com, medically complex individuals, do you have an idea of how many in a percentage-wise that you can accommodate? And we talked about the medical complexities. Okay, we've got the Alzheimer's and the way it manifests, and or the dementia, and the physical maladies and the cancers and heart failures and stuff like that. But is there something in Silverstay that everybody with those complexities, are you able to find something for most?
So, something for most. Yeah. Success rate on identifying, an appropriate care setting is very, very, very high. When you've got really robust data, you can very confidently say, yes, this is a really good setting for you. So we do have a lot of success. And again, we're working with patients. It's the older adults. There's also middle-aged, individuals who has sustained a stroke, and it's altered, debilitating stroke, it's altered their ability to get around. It's younger adults who suffer from really severe mental illnesses, the kind of thing that leads to very poor decision making, right? Repeated instances of poor decision making that sort of work against the individual, folks who have bipolar and schizophrenia. And we're able to very successfully identify really robust places for all this broad spectrum of patients. So at a very, very high rate. And not every transition is a success. You've got complicated patients, things go sideways. You learn from those experiences.
I imagine everybody is unique in their own stuff. If I'm going to put you, Patrick Mish, into an assisted living center, your demeanor is going to be entirely different than mine. It's going to be entirely different from anybody else.
This is exactly it. This is the whole concept. And this is why we love having social workers in our company it's the right to self-determination. You got to meet that person where they're at. You can't, we all may have our vision for what the right solution is, but it's got to be what that person believes is the right solution as well. And sometimes you're dealing with folks a lot of times that don't necessarily have capacity for decision making, but that doesn't mean you're excluding them from the decision making process. In fact, you're trying to, in as much as it's possible, get buy-in with that person on whatever the solution is.
Is there, you talked about folks that may have this pension or something like that. I understand that's
pension,
some sort of a strange archaic term that
there was this one time. Yeah.
Back when they had the Indian head pennies, I guess, but
many years ago. Yeah.
But you've got some folks that have pensions and nice retirements and everything else. And they can go into the Taj Mahal of assisted living if they need to. And as you mentioned, it's all private pay and everything else. Yet you've got other folks that are, medically complex, and I'll say financially complex as well.
Financially constrained. Exactly right. Yeah.
Is there something for everybody? Or close to it here?
Close to it. So, when you get financially constrained, the challenge ends up happening when, in our parlance, financially constrained is someone who doesn't have enough money to support the care needs that they have. The Medicaid threshold for an individual, I think, is around $1,400 a month right now. So if you're under that threshold, you qualify for Medicaid. In Maryland, the Maryland Medicaid program has a lot of programs that are meant to help folks who have higher care needs and don't necessarily have the money to be able to afford those care needs. So to some extent, they can get access to in-home caregivers. That program will pay for assisted living in certain scenarios. And there's a few other programs that are out there as well. The problem is with like entitlement benefits at large is there's waiting lists. So some of these resources you can get access to very quickly. But, if I'm a person who's failing at home, maybe I'm living in a rented apartment, right? And I've got $1,200 a month coming in. And whatever the medical condition is, it gets aggravated, right? So now living in that apartment really isn't feasible. So maybe I end up at the hospital. And so the hospital deals with whatever need I have, but I can't go back home.
I mean, they fix it, repair it, and...
But now I can't go back home, right? Because that environment, maybe I can't make it up the steps, or maybe I just can't do the things I need to live on my own and there's nobody else out there. So Medicaid, there is some access to caregivers to come into the house for a certain number of hours. And then there is what's called the Medicaid waiver, which will pay for assisted living. And the problem with the Medicaid waiver is great program. Not every state has this great program, but there's a 4-year wait list, right? If you're on the less needy side, that wait list is 4 years.
Wow.
If you're on the more needy side, it can be as long as a year to get access. So what do you do in that gap period of time? And so we work with an enormous number of patients that are stuck in this exact scenario. And so then you think about, okay, could that person go to long-term care or a nursing home? So if they could go to long-term care, then Medicaid will cover that expense in a long-term care facility. But is that the right environment for them? Are they sick enough, quote unquote, by Medicaid standards to go into that environment? There's all these kind of barriers that begin to emerge.
And that's exactly where you guys come in.
Yeah.
How do you measure the success of your clients, patients? Yeah. I'm not sure what the term, but you've done the data. You say, okay, this is a great place for John. I'm in there. How do you measure that I'm happy, that I'm thriving as best I can there?
Yeah.
I mean, is that something you do?
We do. Absolutely. So this is a huge part of what we do is follow up. So in order to collect all this data, you've got to do follow up. You've got to understand what were the outcomes for the people that you worked with. So it's a big driver for us just to collect data on understanding how is this community performing? Are they performing in the way that we think they should based on historical data? And how is this individual doing in that community? So is this person really thriving like we thought they would? Are they not? If they're not, why not? Has their medical situation changed to a point where we need to think about something else? So it's not uncommon for us to check in with the community and say, hey, yeah, there's been some significant changes and I think I'm going to have to send this person out to the hospital. And it's like, okay, got it. And so let us know what hospital they end up at. We're going to call the hospital. We'll start working with the hospital to see if there's a different solution we could put in place for that person if it's not going to work in this community any longer because they've gotten medically more complex.
So from the first time we go to silverstay.com and create an inquiry.
Yep. Go to our website.
Provided that we go through, I mean, you're following us through to the point where we're in a community, we're living there, we're making sure that we're doing okay there.
Yeah.
I mean, does your involvement end?
So we will typically follow a case. On the long side, it can be a year or more.
Okay.
Typically for 90 days. Sometimes it'll go 6 months. It's a little bit situational. So if we get someone into a community and things are going really, really well and everybody's feeling good, then it's okay. We'll check back in 45 days, 60 days and just to confirm that things are continuing to go well. If it's a really like vulnerable situation, so you've got income challenge, a really complicated case, we're going to be on top of that case probably week over week, like looking at him, like what's going on. We see a lot of patients who they're their own decision maker. They need support to live safely. They don't necessarily want that support. They're willing to maybe go along with a plan for a period of time. But then, one day they just decide to get up and go and they leave and they're gone and they're taking a train to DC or they're on a bus.
Right.
And, those patients, like it's really being on top of what's happening with them day over day. Whatever the concern is that's motivating them to want to leave, how can we try to get ahead of that to help them think differently about leaving?
That's fantastic. How do you guys, I mean, you're a business. I mean, is it a fee to have you work with the placement?
This is an excellent question. And so for our services, the vast majority of the time, so 99.9% of the time, there's no charge to a family whatsoever. So the way we get paid, and this is very much how the assisted living market works today, is when we do a placement into an assisted living community, that community will pay us a commission. And that rate can vary depending on the community that we go into. So then it's like, okay, well, there's some biases that are potentially created there, right? So we're super transparent about
Well,
this.
I'm going to sit there and say probably, that was my initial thing.
Yeah.
I'm going, okay, I mean, when I own my travel agency, it's like, well, okay, who are you married to, the client or the cruise line?
Exactly.
And the same thing. But again, you're not, I mean, if you turn around and you said, okay, well, we're going to say where we're going to go to, Sunrise, Severna Park or Millersville or, and it was just Sunrise. Yes, I totally see that. But you're sitting here talking about 1,400 plus facilities that you use, and some are, probably independently owned by family.
The vast majority, probably 80% are independently owned and operated.
Corporately. So, I mean, you're not married to anyone in particular. Yeah. So that really sort of puts it back.
So the checks and balances for this, because it definitely creates some bias. So the checks and balances on our side are, one, licensed social work team, right? So that team is focused on not trying to sell a solution to a family, but trying to get a patient into the clinically correct environment. And if that means getting them back home with whatever the solution is at home that's going to work, then that's what we're going to do. They're licensed, like their licensure depends on.
So your social worker could go out and look at a case and sit there and say, okay, well, the best place for this person is back at their home with a hospital bed and a walker.
Yep.
For whatever it may be. That happens. I mean, then you get nothing.
We get zero. Yeah.
You get zero at that point. The patient is cared for.
Then
they're renting the bed of the walker.
What we get is the satisfaction knowing that patient is in the right environment.
Well done.
Yeah. And that's what it's about. So for us, this is what we're passionate about. This is the mission of the company, and we got to make money, got to pay our bills. And so there are those patients that do need to really go into assisted living, and that's the right environment, and everybody is bought into that. And that's the model that is in place. There is a segment of patients that we work with that come out of hospitals, and we do some unique things for those patients on the hospital's behalf, and the hospital pays us in some of those circumstances as well. So it's a little bit of a different model around that.
That's really good. Do you find that, as you start to work with a family or with a case or a patient, you're actually guiding the patient? And I don't want to say selling, but I mean, going through their options and sort of convincing them that this is the right move for them.
So, the goal is not necessarily to convince them of anything. It's try to understand what's the vision for the outcome that you want here, right? Starting with, if it's a patient that's got capacity, and even if it's not, right? The people who are helping make decisions, you're coming together and saying, what do you guys envision this looking like? Let me help you understand the options, right? Because it's really confusing. Assisted living, nursing homes, long-term care, in-home care. Well, let me lay all this stuff out for you. And then you guys tell me, what do you think right now is the right solution?
Where do you fit?
Yep. We'll say, here are the pros and cons, right? Okay, this environment, here are the pros and cons. Here are the pros and cons to this environment. Here's what this could look like. Okay, you're telling me you want to go into, this really expensive assisted living community because, there's a lifestyle aspect to this, but the money you're going to spend in that really expensive community is going to run out in a year and a half's time. Do you think that you're going to live longer than a year and a half? Oh yeah, I'm going to live for the next 10 years. Well, so what are you going to do for the other 8.5? Oh, well, okay. I hadn't really thought about it from that way. Okay. Let's look at this a little bit differently then. Okay.
Get the hard questions out there. Yeah. It's got to be a difficult conversations for the folks that work with you that go out and work with these families.
This is you have to have the skill to be patient and listen and hear and be super inquisitive. These are part of our values. So our values are focused around love, learn, lead. So you got to be empathetic with people. You got to try to get into their shoes. You have to appreciate and meet them where they're at today. You got to hold them accountable. You can't enable behaviors, but you also have to understand where they're coming from, their history. And you got to learn. You got to be curious. You got to ask the questions like, what is this going to look like? How are we going to get there? Let's brainstorm this. And you got to lead. You got to be willing to take chances and do things differently, creatively, innovatively. That's the bread and butter of our value system and guides everything that we do so that our frontline team can go make decisions on their own confidently, knowing that what they're doing is in the best interest of the patient, the company, and all the constituents who are involved.
You guys established what in 2017?
2017. Yeah.
So you are now 7 years old, still considered startup-ish, or I don't know. We'll figure out. I mean, I'm trying to get to where do we look in 5 or 10 years from there?
Yeah. So I guess I would put us in the late startup phase,
right.
For sure. Our big picture goal is to be the most respected and trusted transitions support company nationwide by 2030. That's the mission that we're on. There's so many folks out there who need the services that we can offer, and the need is so great. And with the shifting demographics, it's only getting greater. So
you're looking nationwide in the next 6 years?
Yeah.
And so I can go out to California, and silverstay.com will be just as active out there as they are.
That would be a huge success if that is the case in 6 years' time.
You've heard the term silver tsunami, and I mean, it's a huge need. And I know that you said that Maryland is pretty robust and it's a very good state for that. As you say, you talk about expanding nationally. What does the national picture look like?
Yeah.
I mean, do we have, going back to that question, are there enough beds to handle the guys like me with the silver tsunami guys?
So this definitely varies state to state. So there's a handful of states that seem to really have very robust assisted living markets. So some states sort of back themselves into a corner, and you only get large operators in those states, and you have less of the owner operated market. Now, owner operated is great because the overhead is so much lower and so their rates are significantly reduced, right? When you have all these big operators, a lot of overhead, things are a lot nicer. It's much more expensive. So some states do suffer from this issue. Some states are doing some pretty creative things. So Washington State just recently is imposing a tax on all of their workers. That tax, I don't know what it is, but it's a smaller tax, goes into a fund that then is used to support people who have long-term care needs. And so those that qualify for that benefit, I assume there's some kind of medical need and income-based qualification, get access to up to a $36,000 lifetime benefit. So that's kind of a creative solution. One up in Vermont, a hospital system just bought a hotel. They're taking that hotel and converting it into what is basically a sort of staging ground for folks that don't have any more acute needs, can leave the hospital, but don't necessarily have anywhere where they can go, at least in the near term. So they transition over to these hotel bedrooms, and there's some level of support provided in the hotel setting. So it varies state to state. From an expansion standpoint, from our perspective, we like Pennsylvania, Tennessee, Milwaukee, Wisconsin, looking out in Phoenix, Arizona. There's a couple of different strategies that we have as we think about this from an expansion standpoint.
Where most of the old people concentrated.
Finding the medically complex patients isn't too hard these days, right? They're around. Yeah. So where older adults tend to concentrate is one area, but you also have to have the really robust assisted living network or some type of really robust network of clinically sophisticated housing operators.
Well, I will say that everybody has an older person in their lives, or they may even be the older person.
Mm-hmm.
And a visit to silverstay.com probably should be something everybody should look at. And, even, if you're not ready or something, look into it. I mean, I think that as this business grows, I think this might be something that I would like to tell my children, say, hey, when dad gets a little bit loopy, check these guys out.
Call these guys.
Okay. Whether it ultimately works out or not, but I mean, you really take a lot of the stress out of finding this, because I can't imagine, having a parent or something that has suffered a major stroke. They've stabilized him. They've done what they can do. And they say, okay, fine. He's ready to go out of the hospital. Here he is. And I know darn right well me, I'd be like, go to the yellow pages, which don't exist anymore, and get the first one that was in there that would say yes.
Yeah.
And put me in there. And I'm sure my kids would do the same thing.
Yeah.
Without the guidance and be able, and as you said, with the data, you're finding out whether you're getting complaints from specific operators or specific homes. You're finding out the ones that can deal with overweight people or the ones that are especially good with, we'll say, the dementias.
Yep.
And able to give them the best care and the best life that they can.
Yeah.
And, it's with anything. I mean, you look in the funeral industry. I mean, the worst time to plan for a funeral is after somebody dies. I mean, it's horrible to think about, but I mean, the pre-need thing is huge. I mean, that way it's like you make a phone call. Okay. That's off my plate. Now everything will be handled. And this I sort of see as a very similar type of
We would absolutely love to be having these conversations a handful of years in advance. Okay. So we could just educate. Like, let me just give you a lay of the land of what this is going to look like. People might make different financial decisions, if they knew, what this really, really looked like. So yeah, they can go to our website. They can contact us on the website. They can reach out to me. You can email me at patrick@silverstay.com, and we can have these we love brainstorming with folks when challenges are near term or on the horizon.
I do recommend everybody go check it out. silverstay.com. Real easy website to remember. Patrick Mish, who is the CEO, the founder, and the reformed rocket scientist.
We didn't even get the chance to talk about that, did we?
No. Okay. Explain it. Explain the rocket science thing here.
Yeah, for sure. So, raised by a father who spent his career at NASA as an engineer, engineering was a big part of our life growing up. And so, went to Virginia Tech and studied aerospace and ocean engineering. We were a big boating family, so I had a particular interest in ocean engineering. Loved it, studying at Virginia Tech, and loved it so much as I'm going to stay here and get my PhD, and got connected up with a great professor who was working on aeroacoustics. And Virginia Tech has this fantastic wind tunnel where we did a ton of research, spent hours of time, and so had this really, really great opportunity to pursue a PhD at Virginia Tech. And so I did. It's like, this is great. I love this stuff. Love the technical stuff. Graduated in 2003. Went out and started working for Northrop Grumman. Northrop Grumman at that time owned some shipyards, and they were designing the next generation destroyer for the Navy. And this was a super fascinating project with a lot of really interesting innovation that was going on. And it was the government, and it was a little bureaucratic, and it was a little bit slow moving for my taste. And so it was a little frustrating. And so I ended up, my wife and I are both huge readers. My wife is an author, whole nother topic we talk about. We were early adopters of e-readers back in 2006-07 timeframe, and using those, it was like, oh, we could develop some really cool accessories for those. So it's like, I'm going to start a business making accessories for e-readers. And so a couple of buddies of mine did that, and we grew that business, sold that business, and then about the time I was exiting that business when my dad got sick, and sort of laid the foundation for Silver Stay. So that's how, you get a rocket scientist.
I love to see the trajectory of where people, it's like, where did we think we would be? I mean, I know when my three kids were coming out of high school, if I had to figure out where each of them were going to land, none of them would have landed where they ultimately are. The one I figured would be the biggest screw up is doing cyber for Booz Allen, on government contracts.
Yes.
And loving it. The other one, so it's very interesting to see where, what the trajectories are. And I'm glad that you got out of that engineering thing, and because this is a service that's definitely needed. And I thank you very much for inviting me up to the headquarters here in Odenton. Thank you so much for the service. I think there's probably thousands and thousands of people that do as well. Again, everybody check out silverstay.com, and hopefully it's not in your future, but if it needs to be, probably a great place to start as you have some aging parents or yourself.
Yeah, John, thank you. Thank you for giving us the opportunity to talk. It's been a real delight. I really do appreciate it.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.